So we're trying to have an introduction to what is cervical intraepithelial neoplasia. Of course, we're having this introduction before we now go to start talking about the various stagings of cervical intraepithelial neoplasia. You understand? So for cervical intraepithelial neoplasia, of course, you know that it's just anything that is now trying to like distort the normal way that the cervical cells should be. So if it is normal like this, then you have cells from the down level, okay, trying to infiltrate the cells in the top. Do you understand? Then stage 2, it is more. Alright, so the stages just simply depends on how far the thing has affected you. Then the other stage you are now talking about, it is so much, it's now much more pronounced. So cervical intraepithelial neoplasia, I would say that is a precancerous condition. It involves abnormal cell growth on the surface of the cervix. So the cells growing here, they are not normal. All right, the cells growing here are not the normal cells that the cervix used to have before. So it is not cancer, but if you leave it, if it progresses to stage 3, it becomes cancer. Okay, so it is typically dictated through routine pap smears and human papillomavirus testings. So what causes this cervical intraepithelial neoplasia? Of course, it's mostly human papillomavirus type 16 and type 18. All right, so they lead to like a scattering of the cell arrangement. That's what we say dysplasia. Okay, so other factors could be that the person is smoking, could be that the person's immune system is too weak, so the immune system can't protect you on some basic things. It could be multiple sex partners, it could be early onset of sexual activity, it could be poor nutrition. So classification, this is just what we're looking at here. All right, these pictorials and just in written form. So I have the stage 1, stage 2, stage 3. Of course, from stage 3, if you leave it, it becomes cancer. Okay, now stage 3, if you leave it, it becomes cancer. So for description, stage 1 is mild, stage 2 is moderate dysplasia, stage 3 is very severe. So you can actually look at the risks of progressions and all of it. Okay, so symptoms is irregular vaginal bleeding, postcoital spottings, abnormal discharges. So diagnosis, use pap smears, human papillomavirus DNA testings, colposcopy with biopsy. So treatment, if it is at the early stages, you can just observe. Then later stages, you can do cryotherapies, laser ablations, loop electrosurgical excision procedures, cone biopsies. Okay, so that's what we have for cervical intraepithelial neoplasia.